Okay, so today we're going to be looking at the question number 12 of the surgery CMS form 3. And as I've been saying since the past few videos of this series, that I'm going to provide a better explanation than the one provided in the NBME forms, in the original CMS forms. I think I can do a better job in explaining those questions to you. So today we have this question in front of us. So let's try to understand how to approach it. An ECG shows normal sinus rhythm with non-specific changes and frequent PVCs. Which of the following is the most likely cause? PVCs is preventricular contractions. A 65-year-old man has frequent premature ventricular contractions in the recovery room following elective repair of an inguinal hernia. So let's mark our important points as we go along. So he is in the recovery room following elective repair of an inguinal hernia under spinal anesthesia. Examination shows a complete T3 for spinal motor and sensory block. Pulse oximetry shows an oxygen saturation of 95%, unchanged from during the operation. Arterial blood gas analysis shows pH of 7.25, which is low. The PCO2, which of 55, which is high, and the PO2 of 75, which is low. So the ECG is showing PVCs, and which of the following is the most likely cause? So a simple question. It's simple in the sense that it is telling us what it wants. We just need to look at all of them and design the cause of the PVCs, right? So let's first always, when you're approached with this kind of a question where you have labs, always just try to dissect the labs first. Just scan the labs quickly and see if there is any problem in the labs. So we have these labs right here. And I've already denoted it that the pH is low. So the pH should be from anywhere from in between 7.35 to 7.45. The CO2 should be in between anywhere from 35 to 45. And the PO2 should be from anywhere in between 80 to 100, I believe so. With reference to those normal ranges, the pH is low, the PCO2 is high, and the PO2 is less. So this is what we have. Now, what does this mean? So this means that we have acidosis, right? So the pH is decreasing, the PCO2 is increasing. So we have an acidosis, and these both of them are opposite, which means we have a respiratory acidosis. So now we know that this patient is going through a respiratory acidosis. He also has decreased oxygen. This is not clinically decreased. This is nothing that we have to worry about, but still, this is a clue. And again, this is positive. He is in the recovery room following an elective repair. So, under spinal anesthesia. Now, what is happening is that a patient that is having respiratory acidosis and is having premature ventricular contractions. So, you need to know what is the connection between both of them, right? What is connecting both of these? Now, if I were at your place and I'm looking at this question during my exam, I would first of all eliminate the obvious ones. So this is not obvious. This is obviously not fluid overload because then this question is pointing. This question has no clue pointing towards fluid overload. So there is nothing in this question that is pointing towards fluid overload. Intraoperative myocardial infarction. Now, a patient with an MI is not going to have PVCs. It's highly unlikely. Patient with MI is going to have typical ST elevations or depressions, right? So either ST elevation or depression. So it's not an MI. Okay. Metabolic acidosis is very blatantly wrong because we just now figured it out with these respiratory acidosis. And the rest of the two options I don't know anything about. So if I'm a student, then I don't know what question, where the question is going, and I don't know what the options are saying, at least I have increased my chance of getting the answer correct. So now it's 50% chance that I'm going to get it correct, because the correct answer is going to be between any of these two. Now we have to understand that there's a fact that you need to remember is that when the patient is undergoing spinal anesthesia, and when they're mentioning the spinal roots, so you need to have a little bit of a knowledge of anatomy over here. Need to have a little bit of knowledge of anatomy over here. Okay, of anatomy, or you have to have a little bit of knowledge of the physiology over here. So what happens is that when blood is acidic, when there is acidemia, so when there is acidemia, which means that the blood is acidic, which means the blood has a decreased pH, lower than 7.35. Acidemia causes PVCs. So acidemia causes problems in the contraction of the heart. So it can cause PVCs. It can also cause other arrhythmias as well. It can cause ventricular fibrillation. Can cause it can cause PACs sometimes, and it can also cause PVCs. So acidic blood can cause PVCs. This one association you must know. So when the patient has acidemia in the blood and is undergoing PVCs, so you know that both of these things are related. There is no other cause of it. And the problem is that why is the acidemia occurring, right? Why is the acidemia occurring? Well, for that you need to have the anatomy knowledge, right? You need to understand why is it occurring. So there is a reason why they have mentioned this T3 to T4 spinal motor pathway over here. The reason they have mentioned is that after some time, what happens is that when the patient is undergoing uh, spinal anesthesia, there are that certain parts of it that directly affect the breathing of the patient. Now, those certain parts are certain segments that you need to remember, right? So, I'm just going to give you a small oversight small hint that I've saved over here. So, what happens is that commonly in a lower limb strategy, target level is T10 to L1, and in an hernia repair surgery, the target level is T6 to T10, right? And you can see this patient has a spinal motor block at T3 and T4. So this is something that is known as a high spinal block, right? So forgive my writing over here, but I hope you can make out what I'm trying to tell. This is a high spinal block. High spinal block means that when the spinal anesthesia has surpassed the upper limits of the spinal segment, and it is not where it's supposed to be limited. Now it's above the segments where it is supposed to be limited. So now this patient is undergoing an inguinal hernia. The, the the target level should be from T6 to T10. However, the epidural anesthesia has evidently surpassed that, and it has now reached the T3 to T4 levels. So even if you don't have that knowledge, you must know that T3 to T4 spinal segments, they power your intercostal muscles. So the IC muscles, right? These are the intercostal muscles that are on your ribs. They actually help the breathing process, inhalation and exhalation. So even if you don't know all of this, like you don't know the spinal segments, you still have an idea of you still have an idea that T3 to T4 they power your intercostal muscles, and if T3 and T4 are completely blocked, because they mentioned that motor and sensory block is there, so they've clearly mentioned. Now, if you have that, if you remember that and add it up at that point, then you can easily choose the answer, which is a ventilatory insufficiency, because the patient is not able to breathe, right? The patient is not able to breathe currently. So if he's not able to breathe, what is happening is that he's storing air in his lungs, and the blood is turning acidic, and it is leading to PVCs. That's what it happened. But just for a general overview, lower limb surgery requires T10 to L1 target level. Inguinal hernia repair requires T6 to T10. Cesarean section requires T4 to T6. And high spinal anesthesia is defined as anything above T4. So anything above T4, it's going to risk cardiac involvement and bradycardia, hypotension, respiratory collapse. That's what's going to happen, right? Anatomical landmarks is just for your own knowledge. You can read them if you want, but they're not related to this question as of yet. Yeah. Now, why can it not be a total sympathetic block? Because breathing is not a sympathetic response. Breathing is a normal response. So this makes no sense over here. Total sympathetic blockade actually means that when you have a when this question would give you hypotension or bradycardia and stuff like that. But because they have only mentioned and concentrated on this part, this aspect, the breathing aspect, that is why they're pushing us towards this answer. If they wanted total sympathetic blockade, they would have given us other clues. I've also written down some notes from their explanation as well. Let me see. So yeah, so if this was total sympathetic block, they would have given you hypotension, bradycardia, vasodilation. But since they haven't given you any of that, which means they're trying to push you towards this ventilatory insufficiency option. Okay, so I hope this was clear.